so
super
ready.
excited. Look at all this research that I found just for you.
You know what? You have a lot of questions.
That
I
whole
have a lot
binder
of
there is
answers.
full.
I'm scared.
Okay, you're gonna do great. All right, here we go. On your mark, get set, go.
My name is Bilal. I did my presentation on schizophrenia. Oh, it worked. Schizophrenia is a severe and chronic mental disorder affecting how an individual thinks, feels, and behaves. It's characterized by a range of symptoms, including delusions, hallucinations, disordered thinking and speech, and social withdrawal. Mr. Loki, do spell out some background history. Schizophrenia was discovered by Emil Kraepelin and named dementia praecox in 1893. Eugene Bleuler coined the term schizophrenia and emphasized the early characteristics of the disorder in the early 1900s. In the 1950s, antipsychotics were discovered and used in treatment. In the 60s to 70s, the neurochemistry of schizophrenia advanced, and there was the discovery that there's a lack of dopamine in schizophrenia, which helped advance treatments and medications. In the 1980s to 90s, research on genetics identifying genes that increase risk of schizophrenia were found. And in the 1990s, brain imaging techniques like MRI and PET provided new insight into the structural and functional abnormalities of the brain in schizophrenia. And in the 21st century, we have discovered advances in genetic and neuroscience research, leading to a further understanding of the mix of genetic and environmental factors. Research focusing on the role of the immune system in schizophrenia has begun, and new treatments such as CRT and TMS have started to become used. Where are we going after that? Some important figures in schizophrenia are John Nash. He's an advocate for mental health, and he has schizophrenia himself. Nancy Andreessen, who is a psychiatrist who has helped pioneer studies on neurobiology and the genetics of schizophrenia, and Daniel Weinberger, who is the leading researcher of neurobiology and genetics of schizophrenia. He has helped to lead to developments in understanding the disorder's origins and mechanisms. Cell signaling. There are two types of cell signaling, long distance and short distance. Long distance signaling is a type of cell communication where the signaling molecules act on a target cell that is far from the signaling cells, and local signaling is when cells that are close to one another communicate using signals such as peregrine signals. There's going to be a quote next. It's misplaced, but it works. This is Pete Early. He is a researcher who has schizophrenia. He says, people with schizophrenia are not broken. They are human beings who deserve the same respect and dignity as anyone else. On the transduction pathway, there are 3 steps, beginning with reception, which is when a cell detects a signaling molecule from the outside of the cell. Transduction, which is when the signaling molecule binds the receptor and it changes the receptor protein in some way. Response, which is when the signal triggers a specific cellular response. Actually, we're still on this. The overactivity in schizophrenia, there's evidence of an altered receptor function, which is the reception, and this is especially found in the dopamine and glutamate receptors. In the transduction processes, there is a problem with the regulation of neurotransmitter release and reuptake. And in the response part, there are disruptions in the stage that involve alterations in neuroplasticity, which is the ability of neurons to adapt and change in response to experience. This is the signal transduction pathway. There's a dopamine blockage right there, which could be why schizophrenia occurs. And these are some early symptoms, which we'll come back to. Cell signaling breakdown in schizophrenia. The signal transduction pathway in schizophrenia patients is disrupted compared to a regular person, leading to altered communication between neurons in the brain. This disruption occurs in multiple neurotransmitter systems, particularly dopamine and glutamate, which are involved in modulating cognition, emotion, and behavior. In a regular person, neurotransmitters such as dopamine and glutamate bind to their respective receptors on the surface of the postsynaptic neuron, which triggers a cascade of intracellular events, including activation of various signaling pathways, gene expression, and protein synthesis. These events ultimately lead to changes in the function and plasticity of the postsynaptic neuron, which contributes to learning, memory, and other cognitive processes. Overall, the signal transduction pathway in schizophrenia patients is disrupted compared to a regular person, with alterations in the function of dopamine and glutamate receptors, as well as alterations in the regulation of neurotransmitter release and reuptake. These disruptions can lead to, as I said, altered communication and ultimately contribute to the symptoms of schizophrenia. The mesocortical pathways communication in schizophrenia causes the development of oligodendrocytes to be delayed, which in turn causes the cells to not create enough myelin, causing signal transmission with the neurons to be impaired. This eventually causes a deterioration in the mind of anyone who is diagnosed with schizophrenia. It is thought that abnormalities referring to the overproduction yet hypoactivity of glutamate in schizophrenia signaling may contribute to the cognitive deficits we see in schizophrenia. Diagnosis. Schizophrenia diagnosis begins with the presence of symptoms. These symptoms must cause significant impairment in social, occupational, or other areas of functionality. The symptoms cannot be attributed to any other medical or psychiatric condition. The duration of the symptoms must be at least 6 months. Evaluation to rule out other neurological disorders or substance abuse, a physical exam, and lab tests to rule out other medical conditions. Diagnosis is not always straightforward and can be difficult to distinguish from other psychiatric disorders. Therefore, a mental health professional must evaluate the patient for a critical and accurate diagnosis and, of course, appropriate treatment. Okay, the causes of schizophrenia. The exact causes are unknown. Research suggests a combination of physical, genetic, psychological, and environmental factors which can make a person more likely to develop the condition. If genetic, the mutation would most likely occur in the frontal region of the brain, as it is a mental disorder. Studies have found that the risk of developing schizophrenia is significantly increased if a first-degree relative, like a parent or sibling, has the disorder. In fact, the heritability of schizophrenia is estimated to be around 80%. One of the most widely studied genes is the DISC1 gene, which is involved in a variety of cell processes, including neuronal migration, synaptic function, and the regulation of dopamine signaling. Mutations or alterations in this gene have been linked to an increased risk of developing schizophrenia. Environmental factors such as infections also play a role in the development of schizophrenia. The bacterium Toxoplasma gondii has been linked to schizophrenia. This parasite can infect humans through contact with contaminated food, water, or exposure to cat. Another virus is the influenza virus. Studies have found that individuals who are exposed to the influenza virus during the second trimester of pregnancy are at an increased risk of developing schizophrenia later in life. Environmental factors such as stress, drug use, and infection have been implicated in altering this balance. Factors such as stress have been shown to increase the activity of the HPA axis, which releases stress hormones such as cortisol. Elevated cortisol levels have been associated with dopamine release, causing the positive symptoms. Symptoms include hallucinations, delusions, hearing voices, change in routine, cognitive deficits, disorganized speech, a higher susceptibility to mental illness, sudden behavior change, amnesia, impaired motor condition, body language changes, mood changes, paranoia, and poor hygiene. Treatment begins with antipsychotic medications. Then, if that doesn't work, we have cognitive behavioral therapy and cognitive remediation therapy. The last line would be transcranial magnetic stimulation, which is when they use electromagnetic waves to fix the brain. This is the medicine. This is cognitive behavioral therapy, which they talk about how they think, what they do, and how they feel after what they do. This is supposed to be transcranial magnetic stimulation, but basically it's like a magnet that goes on the head. Some facts about schizophrenia. Schizo means split off, referring to schizophrenia patients being split off from reality. 1 in every 100 people is affected by schizophrenia. Not all people with schizophrenia are violent. Individuals with schizophrenia are more likely to have a reduced sense of smell. Individuals with schizophrenia struggle with recognizing emotions. And people with schizophrenia are more likely to be intelligent. Those with schizophrenia are more likely to develop physical health conditions like diabetes or heart problems. And World Schizophrenia Day is coming up on May 24th. Schizophrenia awareness. Awareness is important as it helps people seek help, and it gives more people a public knowledge and a better understanding of schizophrenia. Current research includes genetics, brain imaging, neuroinflammation, digital technologies, gut microbiome, and environmental factors, and that's the brain. That should be my sources, and that's it.